Grandma Rose asks the following question about antibiotics and painkillers. She says, I have a question for the doctor. I am having extensive dental work in Costa Rica in 2 weeks, extractions, implants, and permanent bridges. I am 1 year after my Roux-en-Y gastric bypass. I will need to be on antibiotics, and of course I want painkillers. Would it be safe to take antibiotics? Would it be safe to take the painkillers? And I've also heard that you can't take supplements when you're taking antibiotics. What do you think? Well, those are good questions. There's no reason why you can't take antibiotics and painkillers after you've had a gastric bypass. The only painkillers that we're concerned about are the nonsteroidal anti-inflammatory drugs like ibuprofen and Aleve and naproxen, other drugs in that class. In general, the narcotics are fine. Of course, the smallest dose for the shortest possible time. Tylenol is fine. There's no problem with that. There's a synthetic narcotic called Ultram that works pretty well for most people. Now, in general, after gastric bypass, we try to stay away from the nonsteroidals because in higher doses for longer periods of time, they can cause problems with ulcers at the gastrojejunal anastomotic margin. In other words, they can cause an ulcer where the stomach and the jejunum go together. But for a couple of days or 3 or 4 days, I don't think there's any real problem with that. And I think that one should take the precaution at the same time of using an acid blocker while one's taking the nonsteroidal drugs. So for a short period of time, it's probably fine. Now, then moving on to antibiotics, I think that you can take the same antibiotics that you would normally take in the same doses. There shouldn't be any problem there. Then the other half of the question was, is there any effect of the on supplements if you take antibiotics or vice versa? And the short answer to that is no, I don't think there's any difference. You can go ahead and take the same supplements while you're on your antibiotics.